We are joined today once again by Dr. Shawn, Orthopedic Spine Surgeon at Community Medical Center. It's great to talk to you and have you back, Doctor. Thanks for taking time with us.
Thank you so much for having me. It's great to be back.
Dr. Shawn, we're happy to have you back. And can you remind our listeners about what your area of expertise with the spine is all about?
I am an orthopedic spine surgeon. I focus on spine surgery and the non-operative treatment of spine-related problems from the cervical spine all the way down to the lumbar spine.
Now, is there a certain group of people who are more likely to experience back pain because it can be debilitating?
That's right. Well, you can divide patient populations into a younger population and an older population. In the younger population, typically spine-related problems come from trauma, such as a car accident or a fall or a work-related injury or a sports-related injury. And as we get older, our spine-related problems are more degenerative in nature or arthritic in nature.
Doctor, how do we treat back pain?
Well, it can be treated in two different ways. You can treat it non-operatively with medications such as anti-inflammatory medications or physical therapy and rehabilitation. You could also consider minimally invasive techniques such as injections into your spine that can help alleviate pain. Typically, most patients that have a back-related problem, they tend to resolve with time and some rehab and some anti-inflammatory medications. However, there is a certain percentage of patients whose symptoms don't get better with conservative management, and when they don't, that's when we consider something more surgical, and that could consider a mild, small, minimally invasive surgery procedure, or sometimes they're much larger, more invasive procedures. It depends on what the pathology is.
Yeah, let's talk about that. What kind of procedures can be done to help alleviate back pain when you go a little step further into it?
If you have something like lumbar stenosis, which means that the nerves in your back are getting squeezed, you can do a decompressive procedure that just helps alleviate the pressure on the nerves in your back or in your neck. That will help with arm and leg pain and weakness. You can do a little bit further from that, and you can have a fusion procedure that can help address both nerve-related problems and instability problems that you may have in your neck or in your lower back. And the fusion would involve something like screws and rods to fuse that segment of your spine to help back pain and with neurologic problems. So get disc replacement, such as in the cervical spine, where you can get a hip and knee replacement. You can do a similar thing in your cervical spine for certain indicated patients, where they can get a disc replacement in their cervical spine, and that can be very helpful for certain patients as well.
Doctor, if someone is listening right now and is interested in contacting you or taking the next step, what should they do?
Well, they can get on the website rwjbh.org/community. That's our website there. You can also reach my office at 732-349-0488, and we're happy to see you.
Dr. Shawn, thanks for taking time to talk about the spine with us today.
Thank you.
You got it. Thank you so much. Thank you for having me.
Oh, you bet.